This week's reflection is about GI. So let's see. If I think about it, I guess during at our clinical site at Auburn Post Acute, I have cared for patients that have had have been experiencing constipation, which is common amongst those who are in long-term care because of mobility and medications. Um, a lot of the patients aren't mobile, but there are a few that are. So that can actually be a big contributor to their bowel functions. Also, I don't think they intake as much fluid as they should, which helps with like moving their bowel movement because the longer it stays in your big and large intestine, it tends to soak water out of the stool. It does affect a lot of the patient's comfort because they can experience like abdominal pain from blockage or backing up of like their stools. It could also increase the risk of like further complication if it's untreated. I guess there are some nursing interventions that could help manage the patient's symptoms of constipation, such as like monitoring their bowel movement when they last took their last bowel movement, encourage like more fluid intake to help move that bowel through their large intestine, promote like mobility to move it around, and like administer like prescribed bowel medications to help them like move their bowel through their system, and they would actually feel a lot more relieved afterwards. Um, I guess another thing that the healthcare team could also monitor is their abdominal status and assess for any signs of like worsening of signs where we will have to or worsening of symptoms where they may have to go do more like an abrasive treatment to get that impacted stool out. Um, from like this experience, I guess I understand like the importance on assessing and recognizing factors that contribute to like constipation and mobility and medications and not drinking enough fluids is a major factor that actually contributes to that. These small interventions can like improve the comfort of the patients, which is what our main goal is to provide them comfort and safe care. Let's see. I guess I will go on to the clinical judgment part of this. Let's see. The situation, I guess I could say, is I care for a patient who had like a bowel movement, hasn't had a bowel movement for like several days, and I was complaining about like abdominal discomfort. What I would do is I would review the patient's bowel history, note any complications of bloating or discomfort that they had in the past, and observe if they have any limited mobility and kind of like keep track of their in and out of fluids throughout the time, which is like, well, obviously, because the less fluids you intake, the more likely you're gonna have to be constipated. The priority concern of constipation is related to decreased mobility and the medication effect, which can lead to worsening like discomfort and not feeling quite mobile or like comfort. Um, I guess the general solution, I plan to encourage fluid as allowed to assist with mobility, monitor bowel movement, and notify like the RN if there's any changes in the patient's symptoms. The action I would take is I would kind of like what was it? Encourage patient education, tell them to drink more water, have a little bit more movement, and then also administer a stool softener to help them with their bowel movement. Let's see, the evaluating outcome, uh, which I think most of them actually like the patients tend to be more comfortable afterwards, after they have had their bowel movement. And so I guess what I learned from this is this experience helped me understand how what was it GI elimination issues can significantly affect the patient's comfort levels and like quality of life. Yeah, thank you.